My name is Karl Heward, and with me today is...
I'm Raquel. Hello.
And yeah, so we're talking about the impact of a new pathway in medical school. So next slide.
So just some background on what we're going to talk about. Evidence suggests that there are a few specific course offerings on evidence-based medicine topics of nutrition, exercise, and personalized patient care. Significant gains in patient health can be made through talking about things such as nutrition, physical activity, sleep, and stress. These topics greatly influence patient health and are often minimized by providers. There's a strong societal demand for guidance in this area. I think the more and more we see sort of headlines on things such as sleep and stress and nutrition, the more patients come and ask these questions. So due to these factors, the University of Utah implemented the health promotion and integrative health pathway. Go to the next slide.
Yeah, so so they implemented several pathways, and so to give you a little bit of background, before these pathways were implemented, there was a course at the University of Utah called culinary medicine, and some of the data that we're going to bring up to you today is based on only that course. But the way that course fits into this pathway is it's one of the electives students can take in order to meet their course requirement to get the certificate from the pathway. So more specifically, the health promotion and integrative pathway includes 300 hours of education over the 4 years of medical school using both electives or research. And the goal is to develop a physician who can champion healthy lifestyles, preventative medicine, and wellness within both themselves, their patients, and the communities that they live in. Next slide.
Yeah, so our goal was to study the impact of a medical school elective health behaviors pathway, as we mentioned, and to talk a little bit about the methods in this project. So baseline data was collected in 2019 on graduating MS4s, so fourth year medical students who were progressing on to residency, and about 89% of the class responded to this e-survey regarding health habits and confidence with counseling patients. And this cohort itself actually only had access to one elective. So, that Karl just talked about the pathway as a whole, but this cohort just had access to the one elective, and that was culinary medicine, of which 17% of survey respondents participated.
So when we gathered our data via surveys, it looks like there was not a statistical significance between those who had in the confidence of counseling patients in the topics you see below there, between people who took culinary medicine versus people who did not take culinary medicine. This is only data from people who could take this one class, and something that I wanted to point out to you is on the bottom of that data there, you can see champion a healthy lifestyle and well-being for a community. Even people who did not take the course still had a, could still basically feel confident in championing these issues, 75% even without that. So, so really interesting that providers report that they don't have enough education, yet confidence here at the University of Utah is still at least 75%. Next slide. Oh, Raquel, you're muted.
Sorry, I'm muted. Dogs in the background. So some implications of this. Overall, confidence is high among both students who did and did not take culinary medicine. As Karl just said, I think, overall really impressive findings that in each of those categories, over 75% of respondents, regardless of courses that they took, were confident in doing things like counseling patients on nutrition, exercise, and sleep. Additionally, qualitative data suggests that culinary medicine is having an impact on both personal behavior and interactions with patients. We'll talk about that in a moment, but while our sample size was quite small, as we showed in those results, getting positive feedback from course surveys and whatnot. And then finally, both students who did and did not take culinary medicine were least confident in counseling patients about stress management. This should be further investigated, as there's certainly a lot of stress in medical school and among medical students, residents, and physicians, and this is something that students were least confident in.
Yeah, so I guess, yeah, we'll answer the question I saw in the chat at the end of the discussion here. So talking just about personal perspectives then, as Raquel said, qualitative data suggests that people who take, for instance, in this case, it was culinary medicine, feel themselves that they have improved because of such. So here I'll just read this. Based on one of the surveys that people took after the course. So I was introduced to many different flavors and food experiences, and it has completely changed how I stock my fridge. Most importantly, I've learned how to incorporate delicious vegetables into most of my meals. This class boosted my confidence in the kitchen, and I have tackled difficult recipes at home now that I understand the vocabulary. Before, it was difficult for me to even identify fresh garlic at the grocery store. And then just speaking from my own personal experience, I feel more confident going in and discussing diet and exercise with patients. And on my rotations, I was actually, that was seen, and I was actually like often sent in even by myself to be able to discuss these topics. Raquel?
Yeah, I would say similarly, going into the third year of medical school was pretty intimidating, and being able to have had experience practicing counseling patients was very helpful for interactions going forward. So we'll advance to the next slide here. In conclusion, many graduating students rate their nutritional education as inadequate. However, even without specific culinary medicine education, 76% of University of Utah students were confident in counseling patients about nutrition. So for future physicians to be able to adequately counsel patients and assist with health behavior change, additional training such as this pathway is needed. And finally, future data collection and analysis is also needed to better understand the impact of both the integrative medicine pathway and the culinary medicine course.
Okay, and so future directions is, so in the future we plan on getting more data. So right now this data is just after the class and comparing them to people who did not take the class. Other data that we plan on collecting is pre and post course. So seeing kind of that personal growth that one has with the class. And then more data that we plan on getting is long-term specialty choice based on the electives they take during the health promotion integrative medicine pathway. And then this kind of data will help us answer questions such as, do these classes actually self-select for people who have better health and lifestyle habits, or do the classes actually impact their behavior? And then also, the goal of this whole pathway is just to have people who complete it feel more confident in counseling patients on integrative health. Next slide.
Yeah, so we just want to give a thank you to all the people who have kind of mentored us along the way, both physicians and graduate collaborators. So thank you.
All right, thank you so much. And we do have a couple of questions, as you noticed, Karl. We have, let's see here. Scroll down a little bit. Dr. Babbitts asked, could their confidence be based on thinking that they had adequate information but did not?
So I think that that is actually a really great question. And I'm trying to think if there's any way that we could control for that. Because yeah, just generally speaking, you know, a lot of information is, you know, presented to medical students. And so they can generally feel just more confident about some of these issues, but without this training, maybe, yeah, it could be thinking they had adequate information, but they did not. I'm actually not sure.
I know in the pathway, one thing we did is sort of take an initial survey and a post survey, trying to sort of assess what our initial knowledge was versus coming out of the pathway, sort of how our perspectives had changed. And so I think that maybe along with this survey, sending a survey, assessing what people's baseline knowledge was and if it was correct or incorrect or how solid it was would be sort of a good next step.
Yeah.
Great. Dr. Jensen asked, to what extent could implicit bias concerning integrative healthcare influence the survey?
Yeah. You know, I think to some extent it could, but a lot of these topics are not, I would say, specifically keyed into integrative health. I mean, counseling patients about things like sleep, stress, and physical activity, there's certainly possibility for bias there, but I do think these things are becoming more well recognized as just important wellness topics.
And then just on that note, we'll actually be starting to get information. So the pathway was actually started when me and Raquel began medical school. And the pathway, people will be completing it and getting the certificate in 2021. And that's when we'll actually get more data in regards to the pathway as a whole, as well as pre and post and things like that. And so I imagine that with more data, we can start to parse out, especially with pre and post, that difference between the implicit bias they might have, as well as new confidence with taking the course.